So I'd like to talk about traveler's diarrhea. This is a topic that those of us in travel medicine feel very comfortable talking about because we see it all the time. And I really can't remember meeting an individual who either has not had traveler's diarrhea or doesn't know someone who has had traveler's diarrhea. Now, what is traveler's diarrhea? Well, essentially, it's diarrhea that occurs during travel, but it's more than that. It's for the most part a bacterial illness that's caused by contaminated food and water. And when you travel outside of the United States, Canada, Western Europe, Australia, New Zealand, and Japan, the rest of the world is potentially a risk for traveler's diarrhea. It's usually the sudden onset of cramps and sometimes nausea and vomiting, followed by loose watery stools that may last a day or even several days. In addition to bacteria, it can be caused by parasites and viruses. And what we do in the travel clinic is we'll educate the traveler about the risk. We will discuss specific food and water precautions that can be taken to minimize the risk. And then we often discuss what to do if you get sick, because it's been shown that anywhere from 30 to 40% of travelers to at-risk areas will get traveler's diarrhea. So there's a method of self-treatment that we will discuss with travelers. The other thing to mention is that when you return from travel, if you're sick, especially with gastrointestinal issues, abdominal pain or bloating or cramping or diarrhea, we now have the ability to make a specific diagnosis of the specific microbe that's causing your symptoms. There's a new technology, and the big name is high throughput multiplex DNA extraction PCR. What that means is the technology looks at the DNA, the genetic material of 22 different pathogens, and within 1 hour we'll be able to match which bug it is that's causing your symptoms. So at our center we have this what's called the BioFire Film Array GI panel, and it's a very, very handy technique because that way we know how to treat you. If it's a bacteria, we'll treat you with a certain antibiotic. If it's a parasite, we may need something else. And if it's a virus, we know it'll run its course without treatment. So traveler's diarrhea, the most common ailment in travelers, something that's important to know about.